Welcome. My name is Eric Wolterstorff, and this is the first series on memory, trauma, and transference. Transference. So transference is when we transfer memories of significant people or significant situations in our past, and we put them on people in our present. So it's like a double exposure of a photograph. Part of us is in the present moment, and part of us, like a second layer, is interpreting what's happening right now as if it were like a significant event in the past. And in the clinical setting, when our clients transfer, we call it transference. And when we, as therapists or group facilitators, do it, we call it countertransference. Okay, here's a couple of stories. So Mary and Joe are taking a ride in the country, and they've had two very different childhoods. For Mary, she would go for drives in the country with her family, and people would drive. Sometimes they would talk, sometimes they were quiet, and it was very peaceful. Now Joe had a very different situation in his childhood. There was a lot of unpleasant drama in the car. His mother would get more and more upset and would fall into silence, and then the anxiety would build, and then she would explode and either yell at or hit Joe. So car rides for Joe are an anxiety-provoking experience. Well, they're driving along for a while, and then the conversation falls into a silence. And when it falls into a silence, the two of them begin to project their pasts onto the present moment. So Joe begins projecting anxiety and fear. Mary projects peace and calmness. So they're fine when it's quiet. But Joe's anxiety is growing, and it's growing, and so he asks. He asks Mary how she's doing. He says, "How are you?" And Mary says, "I'm well. I'm enjoying myself." Well, the problem with that is that's what Joe's mother would say. So he would say, "You okay, Mom? How you doing, Mom?" And she'd say, "I'm fine. I'm fine," which was actually code for I'm getting ready to blow, but I haven't blown yet. So when Mary says, "I'm doing well," Joe gets more anxious. And so he asks again. He says, "Really? Really? How are you?" And Mary says, "Fine." And then he asks her a different question. How's she doing? Then he asks her another question. So he's sort of picking at her. And she says, "Fine." Eventually she says, "Fine," a little bit of an edge in her voice, and he hears that little bit of an edge. Okay, now this is falling into place for him. And so now he presses in. Really? Are you okay? You're sure you're okay? And sure enough, she blows up. Not anymore. You're acting like a crazy person, right? And what's Joe's response to this? Well, he's obviously disappointed because Mary's upset, but he's also almost relieved. I knew it, right? So Joe comes to the affirmation that at least in cars, all women are like his mother. Meanwhile, Mary's been made miserable by Joe's bizarre behavior. Right? So that's an example. So let's say, let's go to transference here. So let's say Joe's the client, and Joe's memories of his past with his mom in the car, he's projecting them onto the present, and he's attempting to entrain, to draw out in Mary the same behavior that he didn't want from his mother. And so maybe that's Joe. And let's say that Mary's like the therapist. But in this one, Mary wasn't a very sophisticated therapist because she fell into Joe's entrainment and responded to his provocations. Well, let's look at a situation that's probably more common, which is when they both have a difficult background, right? So With Mary, car rides could be fine. That really wasn't the issue. Car rides were peaceful, but sometimes her father would fly into rages. Could be in the car, could be anywhere else. Joe, we already know Joe's childhood. So here we go. So there's silence. It's not particularly provocative to Mary yet, but she can begin to sort of sense Joe's anxiety, and then that reminds her of her father. So now they're both projecting onto this silence. So so Joe again, he's in the same place. How are you? He's really worried, and already Mary's a little anxious too. So she's like, I'm fine, how are you? But he hears the anxiety in her voice. So the escalation is happening much more quickly, right? So so he immediately responds to her, the little edge in her voice. You're the one in a bad mood, and you seem irritated, right? So now again, it's building much more quickly, right? Now comes the second silence. He's stuck. All right, so he this is going badly, but he doesn't know what to do. She's quiet. She's afraid that he's going to blow up. So the tension's there. The tension continues, and then he blows up. Right, you're such a pain to drive, and then she becomes passive. Whatever you want. And so now we've got a different variation of a miserable interaction coming from projection from the past onto the present. So another example of transference, right? So now they're both transferring very upsetting memories from the past onto the present, right? And so maybe this is like both of them, and you're working in a group or you're working with a couple, and maybe this is you. Or perhaps you've got a background like that, and even though you're in the therapist chair, you've got a background like this, and your client's got a background like Joe and Mary, and then there's a lot of push for this dance to happen between the two of you. So when we work with this situation, we've got a lot of things to juggle. Well, one of the things that we juggle is we juggle a lot of maps. So, for example, some of the maps that I juggle is how to shift between memory systems during a session from one kind of way of remembering to another. And then another map is Bowen family systems and stress-driven, anxiety-driven family roles and those interactions. And a third map is captivity trauma and working with negative transference. And a fourth map is self-soothing and autonomic nervous system states and attachment patterns. And then a fifth one is developmental trauma and reparenting of the client. So I'm juggling with those maps, right? And then thinking about what sort of transferences or how to interpret the transferences of the client and so on. But then I've also got to watch out for my own countertransferences from the past, plus how I'm going to react to things that the client does, right? So all three of these things sort of spinning around together, juggling, and then I make an intervention, and then the client responds. Now, as soon as the client responds, I'm probably not going to say anything. Now I've got to, as soon as the client said it, I go back in, I interpret that in terms of the maps, I feel the client's transference, and then I feel my own countertransference, and then here comes the next intervention. So therapy is not like regular conversation, right? There's this balance and this juggling of working with transference all the time. Now, let's add another layer of complexity that's happening all the time, which is cultures bring in their own stresses, their own traumas, and misunderstandings between cultures. And so we've got Mary, we've got Joe, same thing as before, right? And then there's the same question as before, right? And there's the same acceleration or buildup as before. You're in a bad mood. You seem irritated. But now now things get more complicated with the cultural issue, right? So Joe's like, it must be my fault. I'm out group here in the United States. This is probably my fault in some way. Mary's like, it probably is his fault. This is a way he gets kind of crazy. I think this is a cultural piece that he's got. But that's not what they say. Boom! He blows up, right? Say something. You're emotionally repressed. You're emotionally repressed, Anglo, right? And then what does she do? She responds culturally, don't be so dramatic, you started this. And so now, in addition to their own family backgrounds that they're projecting, now they're projecting cultural patterns onto each other as well. So now it's even more mixed up. Right. So we're deeply steeped in these transference patterns. We're wired for transference. We're transference machines. This is what we do all the time. And when we have good transference from the past, like Mary had in the first example from her childhood, that's really nice. But if we've got sort of emotionally loaded or upsetting transference, that can dominate the present and keep us from experiencing the present. And the more stress and trauma we've got individually in our family or in our culture, the more we project onto the present, the more it distorts our experience of the world and our relationships. Now, the good news is, that's pretty bad news, but the good news is we can work with it. We can learn about them, and we can lessen them, and we can gain skills to lessen them in the moment. And we're going to show you how to do this here a little bit through updates. This is part of a series in this. We're going to go through each one of those maps and how they affect working with trauma and transference in individual and group settings. And as well, we also offer trainings. We'd love for you to come and join our community and come train with us. All right, look forward to part 2.